many times in your career have you heard of patients having a difficult time affording medication? How many times have you heard about patients foregoing medical care due to cost, ending up in emergent situations? The rising cost of healthcare has affected a large portion of Americans. Deductibles for health insurance rose a great deal after the Affordable Care Act in 2010. According to Lyford and Lash, 2019, 7.5 million older adults report being unable to afford a medication prescribed by their doctor. In 2017, the cost per person of medical expense was $10,739, which is the highest than any other country. This should make us the healthiest nation then, right? This is not so. The U.S. ranks toward the bottom for health for developed countries. Rising healthcare costs reduce population health, prosperity, cause public health and financial crisis, pushing municipal, state, federal, and household budgets to their breaking point. The rising costs of healthcare affects federal budgets as well, as the U.S. spends $3.6 trillion on healthcare per year and is expected to rise to $12 trillion by 2040. According to the Future of Nursing 2020 to 2030, also outlines the ways high healthcare costs affect population health. Within this book, they outline how social determinants of health, such as income, education, and environment, exacerbate inequalities in healthcare. Impoverished families are many times faced with problems of affording food or needed medical care or prescriptions. They also outline how healthcare equity is important to ensure society healthcare quality and access. Healthcare often operates in response to illness rather than cause of health outcomes, such as economic and environmental factors, discrimination and racism, educational disparities, and inadequate nutrition. The rising costs of healthcare should be everyone's concern. This is a multifaceted systemic issue. It is especially important for nurses to take this into account during practice, assess patients' resources needed, if they can afford new medications being prescribed, and evaluate if they need programs in the community to help with medical costs. I hope sooner rather than later I will see a day where patients don't come into my emergency department due to not being able to afford insulin for weeks and now they're in DKA, or patients that come in due to hypertensive crisis due to not being able to afford to see their primary care doctor and taking their needed antihypertensives. Or patients that are a CPR in progress due to avoiding medical care with acute chest pain resulting in cardiac arrest. Enough is enough.